Hello everyone, today I would like to share about the ways to manage intense back pain. Which is a little bit different to a lot of the back pain we see, usually from sitting too long, driving too long, or some muscle imbalance. The intense type of back pain is usually a different type from like heavy lifting or from any sort of injuries or from lifting or doing any physical task with an awkward position which put our spine in a very stressful situation. To manage that condition is a little bit different to managing other types of back pain which are a little bit more chronic, so I'd like to hop on and talk about that a little bit today. First off, let's talk about the mechanism of injury and then the types. I talked about like it's usually from an actual injury from lifting something heavy or lifting something heavier or from a very specific injury. And then usually that results a muscle strain, a muscle being pulled in the lower back, or sometimes it's the actual spine itself being affected, and then most of the time it's the disc, the intervertebral disc of our spine. And then the presentation of that is usually a little bit different. If it's a muscle strain, usually the muscle pull that's happening immediately, you may or may not hear a pop, but then the pain will come in immediately after that, and then you know most likely that's a muscle pull, that's a muscle strain. And then for a disc injury, usually people would have a misunderstanding of like they slip their disc. We often heard that term that is not necessarily a correct way to describe that, because discs don't usually slip like that. And then another thing is usually the pain of the disc injury is from the swelling of the disc, and then the swelling usually won't build up until over time, and then usually people would experience discomfort like several hours later. Say if they were doing some awkward physical task, hurt themselves, usually it's like that evening when they start to relax laying down in bed, and then the muscles are relaxed, not supporting their back anymore, and then the disc just started to inflame and then swell up very badly. That's usually the presentation, which is a few hours delayed, but then usually also because of the swelling, the disc is expanded. That can also press the nerve root and then causing some shooting pain into the leg. So the main difference, the muscle pull usually would result in immediate pain, and then the disc related back pain usually it's several hours later, and then usually that will be accompanied with some shooting pain into the leg. So that's the main mechanism of injury, and then the type of those very acute type of back pain, which is a little bit different than some of the other types of back pain we are dealing with. And then how are we able to manage that? There are some major ways. There are some major principles or tips, I should say, that is considered a first aid to manage these conditions. And then that can usually cover the majority of the muscle pull or some disc-related condition. The conditions can be very complicated from person to person, hence seeing a physical therapist for a thorough evaluation is very important to figure out what's going on. But then, in general, these first aid tips can help the majority of the people to immediately relieve their symptoms when they notice that they injured their back. The first thing is, for either the muscle pull or a disc injury, we want to give them as much extension or backward bending as much as possible. And then the purpose of that is whenever our back is getting injured that way, the injury is usually from a motion of separating a tear, a separation of the tissue, something like that, that's causing the injury and then the inflammation. And then the backward bending situation can make us approximate the torn end each way. By keeping them approximated to each other, we are able to facilitate healing that way. And then usually a lot of backward bending or laying on your stomach, some sort of treatment ways or tips or exercises like that are all facilitating extension. Is to help people to manage very acute, immediate back pain during that time. The second tip is we want to avoid the activities that are the most stressful to our body, which are abbreviated as the BLT. No bending, no lifting, no twisting, especially during that phase of the back pain. We want to make everything calm down and then start the healing process of our body. So definitely avoid those stressful situations during that time. And then the third thing is reduce the inflammation. To reduce the inflammation, there are a couple of things to think about. Oftentimes we know that if we put ice or cold on it, we are able to immediately calm down the inflammation. But then remember that the acute phase of inflammation only lasts for 72 hours. So it's only valid for you to put ice on your body for the first 72 hours or the first 3 days. And then beyond that time, it's okay to switch to heat. And then if you want to start the heat earlier, you can also do that too. Heat doesn't necessarily have like a specific time that's indicated, but then for ice, definitely only the first 3 days. And another thing I want to talk about ice is that ice does create, like, limits blood circulation and then limits swelling. But then if you put ice on your body for too long, it actually causes the blood vessels to be expanded and then the circulation will actually be facilitated again. So we usually only suggest people to put ice on a certain region for 15 to 20 minutes. Don't go any longer than that. Heat doesn't necessarily have that problem if you are doing any types of heat hot pack. It's okay to do like 25 minutes, 30 minutes. That's totally valid. But then for ice, don't go over 15 to 20 minutes. So ice the first 3 days. Heat, you can start whenever you want, and then that helps with pain relief, helps with relieving inflammation, and it also helps to facilitate circulation, especially with heat coming in. And another thing about calming down any inflammation is related to your diets. We know that certain diets, certain food you eat can definitely trigger your inflammation, and we want to avoid that. Taking too much sugar, it's a big no-no. Eating any foods that's processed too much, having any too much artificial processing, we want to avoid those. And then another thing is make sure you eat a lot of vegetables and fruits, and then particularly a lot of citrus fruits, berries and nuts, and also dark green leafy greens. Those are the things that can really help us calm down the inflammation within our body. But then another thing is that it's related to fat that we are eating. We know that we want to have unsaturated fat to help our body to get healthier. But then there are many different types, and then the major ones are omega-3 versus omega-6. And then during that time, you definitely want to lower omega-6 and then increase omega-3 so that you can facilitate the healing of your body and then calm down the inflammation. And then so if you like to use vegetable oils for cooking, olive oil would be your optimal choice. This is very, very generic health wellness perspective of diets. If you have any specific dietary needs, definitely consult a registered dietitian. So these are the 3 major tips. But then, like I said earlier, everybody's back pain presentation can be a little bit different depending on different types of activities they are doing. And then also, these first aid tips are only helping you to immediately relieve the symptom right after the injury. And then in order for you to get better, you also need some sort of hands-on work to relieve the muscle guarding and then to improve your range of motion for flexibility and also your endurance, and then eventually return to going back to work. You definitely want to see a licensed, qualified provider, and then ideally a physical therapist can help you with the recovery process. So with this being said, definitely chew on the first aid tips, but then whenever you guys need any help, definitely look up a qualified provider. I'm Andy Zan, physical therapist, occupational therapist, and also a Pilates instructor at CORE Therapy and Pilates. You can find more information from our website, therapyandpilates.com, or call us at 512-215-4227 for more information. We will be happy to help you. That's all I would like to share with you guys today. I hope you guys have a great day. We will talk soon. Later.